Hi, my name is Dr. Philippe. I'm a board-certified family medicine physician, a former Division I basketball player, as well as a former personal trainer. Whether you're here for nutrition tips, wellness advice, exercise insights, or general health knowledge, you've come to the right place. Now, in my last video, I covered several different popular diets, and in this video, what I want to do is spend a little bit extra time delving deeper into the ketogenic diet. What exactly is the keto diet? Now, this diet is one that's made up of mostly fats and protein. Put it simply, high fat, low carb. Really low carb. And the goal is to put your body in a state of ketosis. What ends up happening is that it chooses a different fuel source for energy. Under normal circumstances, your body would use carbohydrates or carbs for its main source of energy. However, with the ketogenic diet, because you are decreasing your carb intake to a very low level, your body then switches to then using alternative fuel sources. And what is left to be used? Well, predominantly fat, and in some cases muscle as well. When you're in this state, this is known as ketosis, and this is the goal of the ketogenic diet. So why would someone determine, or why would you decide to embark on a ketogenic diet? What are the pros, what are the cons, etc.? So let's delve into that really quickly. What's fascinating is that with the ketogenic diet, it has been shown to cause significant reductions in blood sugar levels as well as insulin levels. One review of 13 different studies found that following a very low carb diet, a ketogenic diet was slightly more effective for long-term weight management compared to a low fat diet. And people who followed the ketogenic diet on average lost more pounds than the group that followed the low fat diet. The ketogenic diet has also been shown to reduce diastolic blood pressure values as well as triglyceride levels. It has been shown to improve risk factors for cardiac health, such as LDL cholesterol, improving HDL cholesterol, as well as improving blood pressure, as well as blood sugar. The ketogenic diet is being looked at to determine its efficacy towards fighting cancers, as well as reducing symptoms of Alzheimer's disease. And by improving insulin levels, it has been looked at in terms of its role in assisting with polycystic ovarian syndrome. There are definitely certain cons that you want to be on the lookout for. First one being bad breath. And anecdotally, there are people who will describe to you what's known as the keto flu. Basically, certain symptoms that they were experiencing as their body sort of adapted and readjusted to the new fuel sources that were being used, the different types of foods that they were eating, etc. And symptoms of the keto flu include the following: poor energy and mental function, increased hunger, sleep issues, nausea, digestive comfort, and decreased exercise performance. Other symptoms include diarrhea, constipation, and vomiting. Now, ways to minimize those potential side effects would involve doing a low carb diet for a few weeks prior to transitioning to an even lower carb consumption. And by doing that, it may allow your body more time to adjust to having severely low carbs in terms of your daily intake. Another potential con for the ketogenic diet is the fact that it can affect your water and mineral concentration in your body. So that's something that you want to look out for. Make sure to stay hydrated with your electrolytes. What I wanted to talk to you about briefly, really briefly, was to discuss some of the long-term potential negative effects that you might experience on the ketogenic diet, including but most likely not limited to the following. You may experience some micronutrient deficiencies. You may experience kidney stones, extra fat in the liver, and maybe even low protein in the blood. If you take certain diabetes medications, specifically SGLT2 inhibitors, you're increasing your risk for what's known as ketoacidosis. So if that's you and you take that medication, you should avoid the keto diet and you should talk to your healthcare provider. Now, what do you eat? Well, first, did you know that there are different variations of the ketogenic diet? There's obviously the standard ketogenic diet. There's also what's known as the cyclical ketogenic diet. There's also the targeted ketogenic diet, and then the high protein ketogenic diet. The standard ketogenic diet, pretty self-explanatory, pretty much the basic version of it. You roughly consume about 70% fats, 20% protein, and only 10% carbs. That's really low. The cyclical ketogenic diet, so 5 days very low carb and 2 days higher carb. The targeted ketogenic diet allows you to add extra carbs around your workouts. And then the high protein ketogenic diet, of course, has a high percentage of fat, but it has a higher percentage of protein as well. So you're looking at roughly 35% on average of protein, 60% fat, and then the rest are carbs. So again, what is it that you eat? Meat. You got red meat, sausage, bacon, turkey, chicken, steak, you name it. Salmon, tuna, mackerel, trout, the fatty fish. You also eat eggs, butter, cheese, nuts, and seeds, such as almonds, walnuts, chia seeds, flax seeds, pumpkin seeds, etc. You get the gist. You also have your healthy oils, such as extra virgin olive oil and avocado oil. You also have avocados. And then your low carb vegetables, such as your leafy greens, tomatoes, onions, bell peppers. And then for spices, salt, pepper, herbs, spices, etc. So that's pretty much the rundown of the types of foods that you could eat on the ketogenic diet. Now, the foods you want to avoid, very important. You want to avoid the sugary foods and sugary beverages, such as soda, fruit juice, cake, ice cream, candy, all the sugary stuff. Duh. In the ketogenic diet, you also want to avoid grains or starches, believe it or not. So that's the wheat-based products, rice, pasta, cereal, and similar. Fruit, basically all fruit, except for things like strawberries and berries. You also want to avoid beans or legumes, such as peas, kidney beans, black beans, lentils, chickpeas. Oh, no beans, none. You want to avoid root vegetables. Those are your potatoes, your sweet potatoes, carrots, parsnips, etc. You want to avoid some condiments like barbecue sauce, honey mustard, ketchup, teriyaki. Man. And then obviously you want to avoid the unhealthy fats. So the unprocessed foods, the unprocessed vegetable oils, mayonnaise, you get the gist. And you want to avoid alcohol, beer, wine, liquor, mixed drinks. And of course you want to avoid the sugar-free stuff as well. So that's the sugar-free candies, syrups, pudding, the sweeteners, and desserts. Really stick with low carb, higher fat, and higher protein. So what's the deal with its effect on diabetes? It has been shown to increase insulin sensitivity in folks with type 2 diabetes. There was a small study conducted in a group of women that found that if they were consistent with the ketogenic diet for about 90 days, they saw a significant reduction in their hemoglobin A1C. Not only that, in another study, it was found that individuals who remained consistent with the ketogenic diet lost a profound amount of weight, I believe upwards of more than 20 pounds over a 2-year period. The biggest reason why diabetic patients and even physicians are advocating for their diabetic patients to consider the ketogenic diet, especially in the short term, is not only because of the ability for it to assist with weight loss, but really the sugar control, aka the glycemic control, controlling your diabetes overall while you're doing this diet. Consistency is really the most important thing. No matter what method you choose, whether it's the ketogenic diet, whether it's the Mediterranean diet, whether it's the DASH diet, whether it's Whole30, doing Weight Watchers, whether it's if it fits your macros, etc., consistency is important. It is the most important factor as it relates to weight loss and improving your health. So if you're thinking about starting the ketogenic diet, wait a second, don't just jump into it. Check out a few of these tips. They might be helpful for you before you embark on this new way of eating. Number one, start familiarizing yourself with food labels. As mentioned in this video, the purpose of the ketogenic diet is to reduce the amount of carbs and increase the amount of fat, and then you're working with your level of protein as well. So understanding how the food label is structured is very important, because you'll be able to look at the food label and determine which specific food items are okay for you to pick up. This next one, number two, plan your meals. I know meal prepping sucks. Logging food in a food journal sucks. Man. However, if you fail to plan, you plan to fail. So setting yourself up for success means that you need to prepare your meals in advance. Set up a shopping list, go through the list of ketogenic friendly foods, develop a quick meal plan. There are a lot of resources available for you online, different meals, quick meals. You also want to consider snacks as well. Depending on the type of job you have, you may be able to bring snacks with you to work that can help curb your appetite or keep your appetite at bay throughout the day, so you're not famished when you get off work. And if you're not famished when you get off work, you can continue to make smart food choices as opposed to grabbing what's most convenient. So there's a saying in medicine, an ounce of prevention is worth a pound of cure, which I believe 1000%. You really want to set yourself up for success. Get all of the food that you need ahead of time. Do your grocery shopping when it's convenient for you. Plan ahead, get the snacks, and you'll be more successful in the long term. You have a higher chance of being consistent, and by being consistent, you give yourself the most opportunity to be the most successful. Number three, don't forget to utilize the resources at your fingertips, your smartphone, your computer, the internet, etc. There are tons of websites, tons of apps, you name it, galore. Use it. Find recipes, find strategies, find advice, use it to your advantage. And then when you're about to hang out with friends, or if you think about hanging out with friends, whether it's going for meals or just hanging out in general, eat before you go. The normal advice in this circumstance would probably be to pack your own food and bring with you. However, I disagree. I think you should eat before you go. If you're not very, very hungry when you go, you can still hang out with your friends and enjoy, quality time with your friends, but but also you're not tempted or you're not incentivized to make poor food choices because you're out hanging out with friends and they're ordering out, etc. So eat before you go. It'll help. That's it for today, guys. Thanks for stopping by on my channel. Don't forget to like, comment, and subscribe. Drop a comment below and let me know other topics you want me to cover on this channel. And I'll see you guys in the next video.